Bloomberg Audio Studios. Podcasts, radio, news.
You're listening to Bloomberg Businessweek with Carol Massar and Tim Stenovec on Bloomberg Radio and Television.
It is Bloomberg Businessweek. Well, Dr. Anthony Fauci became a household name during the COVID pandemic. However, his journey to becoming the top infectious disease doctor in the U.S. started decades before, and really to his childhood in Brooklyn, New York, living with his family above his dad's pharmacy, Fauci Pharmacy.
He was a basketball player in high school, went on to become a doctor, graduating top of his class at Cornell Medical, spent 54 years at the National Institutes of Health, 38 as the director of the National Institutes of Allergy and Infectious Diseases. During that time, he advised 7 presidents on various diseases, including AIDS, Ebola, SARS, COVID-19, and more. He writes about it all in his memoir. It's just out, On Call, A Doctor's Journey in Public Service. Dr. Fauci is also a distinguished university professor at Georgetown, and he joins us now, right now on Bloomberg Businessweek in New York City. Dr. Fauci, nice to have you here with us. How are you?
I'm well, thank you. Thank you for having me.
Well, it's great to have you here. We've all been talking about your book, and, you know, there's a lot about COVID, but there's a lot more about AIDS, which we want to get into. But the first thing we want to get into is you kept a lot of notes, and I'm curious, we are curious, what it was like going through those notes, putting this book together, going back to, you know, your notes on the AIDS crisis or SARS or COVID for that matter, anything, any time in particular that made you stop, that really took you back in a big way.
Well, you know, when you remember things in your mind 40 years down the pike and you go back over some of the notes that you made back in very stressful times, like those terrible early years of HIV when I was spending most of my time taking care of desperately ill, mostly young, otherwise previously healthy gay men who were suffering terribly and then almost inevitably dying. It really brings back, what I've described, and I mean that honestly, is almost a post-traumatic stress feeling of, my goodness, I went through that and I had to suppress all of those feelings. And then when you start to write your memoir, in order to write it properly, you have to go back and re-examine those experiences and re-examine those feelings. So, what I went through was a journey, but writing the memoir was itself a journey for me.
You know, I want to stay on this topic here because I think it's fair to say there's a generation out there that really has no idea about the AIDS health crisis. And we should remind people there have been more than 86 million HIV infections throughout the world, 40 million deaths. Some news today about Gilead Sciences' experimental twice-yearly shot preventing 100% of HIV cases in women and adolescent girls in Africa. It's the first successful big trial of what's hoped to become a powerful new drug regimen for fending off the virus. There's a part in your book where you write about a visit to the White House in 1996, nearly 30 years ago, when then President Clinton asked you why there was no HIV vaccine. Why is an HIV vaccine still so elusive?
Well, it's a very unusual virus in which the body, for reasons we still don't completely understand, does not make an adequate immune response to protect from or even clear the virus from the body. Most every other pathogen that we get infected with, mankind, civilization, even things that have a fair degree of mortality like smallpox and measles and then the crippling effect of polio, at the end of the day, most people clear those viruses from the body, and the body's immune response serves as a model for how you should make a vaccine to protect a person who's uninfected from getting infected. But we don't have that kind of a situation with HIV because once a person's infected, there are virtually no instances that are documented of someone who's actually spontaneously cleared the virus. There's a very small percentage of elite controllers who can control the virus, but there's no real evidence of anyone actually on their own, through their own immune system, clearing the virus. That's a very high bar for a vaccine to be able to do, because you want to do better than what even natural infection does. And that's the reason why among all the difficult diseases, we just don't yet. I think we may get it because science will figure out a way to do it, but it's been very difficult because of the unique nature of HIV.
I'm always amazed at doctors who are in very difficult situations but stay very level-headed and stay cool. And you have to, I would assume. But I do think about your time with HIV and AIDS, victims ultimately, because you write in your book, you think of the years from 82 until the late 1980s as the dark years of your medical career. I mean, you got to know a lot of these patients. I just can't even imagine how difficult it was.
Well, it was terribly difficult. I mean, and it was even made more difficult by the contrast with what I had been doing in the prior 9 years before we started seeing individuals with HIV, before it was even known to be HIV in 1981. My career had been quite successful, parenthetically, in developing therapies for inflammatory diseases and autoimmune diseases. And we developed some protocols that had diseases that were formerly fatal have 90, 93, 95% remission rates. So we were on a real high, as it were, for accomplishments. And then all of a sudden, you devote the rest of your medical career of taking care of individuals to a disease. For the first several years, essentially all of our patients died, with very, very few exceptions. And you're right, you do get to know them. You develop a really good patient physician relationship, and you really care about them. I mean, part of the art and science of medicine is to care for your patients, and not only care for their medical issues, but to care about them. And that was very tough. And it was several years, because remember, I started taking care of persons with HIV in the fall of 1981, very soon after the first cases were recognized. And then we did not get truly adequate therapy until 1996. We got the beginnings of some therapy, which kind of slowed the disease down, starting in 1987 with AZT. But it wasn't until the triple combination cocktail that showed that you could durably suppress virus to below detectable level. But that wasn't until 1996. So those were really difficult times.
We're speaking with Dr. Anthony Fauci, who's now a distinguished university professor at Georgetown. His new book, out now, it's called On Call, A Doctor's Journey in Public Service.
Dr. Fauci, in the book, you write about how former President Donald Trump would ask, maybe after a tense moment or maybe an argument, are we okay? And would messaging would come back from his team, or even Vice President Mike Pence's team too, that they love you, again, after maybe some tense moments. You've served 7 presidents during your tenure, starting with Ronald Reagan, as we said earlier, all the way to President Biden. Are all presidential relationships complicated, or was just that one in particular?
No.
Yeah.
No. This was and as I mentioned explicitly in the memoir, this was a complicated relationship, a very unique relationship when you compare it with the relationship with other presidents, because we did in the beginning. I mean, even though right now the people who are in the Trump camp, are very hostile to me, I had a very good relationship with President Trump, and we related well to each other. I describe it in the memoir. I don't know whether it was the rapport that two people, who grew up in New York City, me in Brooklyn and him in Queens, had that kind of New York swagger relationship with each other. And it really was fine until I had to, because of the fact that he was starting to say things that were just not correct from a public health and a scientific and medical standpoint. And I was put in a very difficult position, which I did not like, but I had to do it to preserve my own integrity, as well as fulfill my responsibilities to the general public, to have to contradict him in a public way when I was asked publicly, is it going to go away like magic? And does hydroxychloroquine work? Which it doesn't, and it can actually harm you. That's when the relationship started to fray. And even when it did start to fray, I don't think that he wanted to have conflict with me, nor did I want to have conflict with him.
Well, speaking of conflict, for better or for worse, you've become certainly a lightning rod in the dialogue about public health and in the dialogue about COVID. And I'm wondering if you have any regrets about your time as the nation's top doctor in recommendations, in recommending school closures, anything like that in hindsight, given what we know now.
Well, the first thing that we were dealing with a historic, catastrophic pandemic that ultimately killed 1.2 million Americans and more than 7 million and probably closer to 20 million worldwide. At the time that we had to have that physical distancing and that slowing down, we used to call it flatten the curve, when the recommendations, and most people, because I was the communicator of that, because I had been communicating with the public for 4 decades about outbreaks, that I was communicating with the public, there was the misinterpretation, understandably, that I was making all the policy about doing things like shutting down and having physical distancing. I think at the time, when you make those decisions, you do it because you want to save lives. Were they perfect decisions? No. Would you like to have done a better job? Of course. None of us did it perfectly. But the idea about at least slowing down and closing things for a while was the right decision. With masks, with shutting down, with schools, the issue that we need to re-examine, importantly, is how long you did that. And I think that's what we need to re-examine, because if you look back, I was the one that said we should open the schools as quickly and safely as we possibly could, because there is collateral damage when you keep schools closed for a long period of time.
We only have about a couple minutes left here. I am curious what you think the next big health crisis will be. The U.S. Surgeon General is warning about, or wants to put a warning on social media, for example. We're talking about flesh-eating bacteria in Japan. What do you think is the next big health crisis, and are we prepared for it?
Well, there are health crises that are infectious diseases, which is my lane. I still think that we have to be very careful to be prepared better and prepared to respond to the inevitability of another pandemic of an infectious diseases, because history has taught us that we've had pandemics since before recorded history. And we've had it in our own lifetime with COVID. And 100 years ago, we had it with the 1918 pandemic of influenza. So my feeling is that the thing that would be most abrupt and surprising would be another pandemic, but you can't predict that because pandemics are not predictable. But there are a lot of other health crises, some of which you mentioned yourself. I mean, I think the epidemic of obesity in this country, I think the mental health crises, the issue with fentanyl and other narcotics that are killing so many people. Those are the things that we need to address.
Well, Dr. Fauci, appreciate getting some time with you. Thank you so much. Dr. Anthony Fauci, his new memoir, On Call, A Doctor's Journey in Public Service. Not new, it's his memoir. It is just out. You are listening and watching Bloomberg Businessweek, and this is Bloomberg.